Hi, I'm Dr. Nguyen. I am an interventional pain management specialist practicing in Summit Health, located in Ocala in the Villages, Florida. If the patient's initial treatment has failed, meaning if they've used over-the-counter medications like Tylenol or ibuprofen or naproxen, if they tried rest, if they've tried ice treatments, and they're still continuing to experience pain and dysfunction, those patients should then see a pain specialist. One of the main reasons why patients present to the emergency department is for low back pain. So by virtue of that, a lot of times we will see chronic low back pain as well as acute low back pain present to our clinics. Including, we also see neck pain as well in the cervical spine. We're board certified to treat disorders of the joints such as the knee joint, the hip joint, as well as the shoulder joint. Oftentimes, the primary care doctors will actually see the patients first for a patient with low back or neck pain. And oftentimes, the primary care doctor will prescribe a certain first-line treatment, which again will include over-the-counters, maybe physical therapy, maybe ice or rest. And if those treatments are not improving the patient's function or allowing them to continue with their athletic endeavors, that's when a pain specialist referral is absolutely needed and warranted. So the first step in treating a patient with chronic pain is to first diagnose why they're having pain, to identify what we call the pain generator. And we utilize a combination of x-rays, CT scans, MRIs, and also the physical examination, as well as a detailed history of the patient's issues. The second step is we do activity modification. We try to strengthen the patient's core if they need that, or the low back pain. We try to get them to stretch the areas more. We will then utilize some medications to some degree. The goal is to not medicate them too much, but maybe enough just to reduce inflammation or swelling in that area. We also utilize interventional pain management procedures, which is where we use a fluoroscopic machine, as we see in the background here, which essentially acts as a live x-ray camera in which we can see their spinal structures. We then utilize needles to direct medications into the spinal column to reduce inflammation. If patients need more than injection treatments, then we can also do some minimally invasive spinal procedures to them as well. Those are procedures that usually require very small incisions. The recovery period is 1 to 2 days, or sometimes a week or two. And nowadays we are actually board certified to do some of those as well. So we are actually able to fix the issue rather than just medicate it with a certain procedure.